Advil Migraine, also known as ibuprofen, is a pain reliever that can be used for various conditions such as headaches, dental pain, menstrual cramps, muscle aches, and arthritis. It can also reduce fever and relieve minor aches and pains due to the common cold or flu. As a nonsteroidal anti-inflammatory drug, NSAID, Advil Migraine works by blocking your body's production of certain natural substances that cause inflammation, helping to decrease swelling, pain, or fever. If you are treating a chronic condition such as arthritis, it's important to talk to your doctor about non-drug treatments or using other medications in addition to Advil Migraine. Make sure to check the ingredients on the label, as the manufacturer may have changed them, and products with similar names may contain different ingredients meant for different purposes. It's important to take the correct product to avoid any harm. When taking Advil Migraine, make sure to carefully read the directions on the product package if it is an over-the-counter product, or the medication guide provided by your pharmacist if it has been prescribed by your doctor. Take the medication by mouth, usually every 4 to 6 hours with a full glass of water, unless directed otherwise by your doctor. It's important not to lie down for at least 10 minutes after taking this drug. If you experience stomach upset, it's recommended to take it with food, milk, or an antacid. The dosage of Advil Migraine is based on your medical condition and response to treatment. To reduce the risk of side effects, take this medication at the lowest effective dose for the shortest possible time. Do not increase your dose or take it more often than directed. For ongoing conditions such as arthritis, continue taking this medication as directed by your doctor. If you are using Advil Migraine for a child, the dose is based on the child's weight. Make sure to read the package directions to find the proper dose for your child's weight. It may take up to 2 weeks of taking this drug regularly until you get the full benefit for certain conditions. If you are taking this medication as needed, remember that pain medications work best if they are used as the first signs of pain occur. If your condition lasts or gets worse, or if you think you may have a serious medical problem, seek medical help right away. If you are using the non-prescription product to treat fever or pain, consult a doctor if the fever gets worse or lasts more than 3 days, or if the pain worsens or lasts more than 10 days. Some common side effects of Advil Migraine include upset stomach, nausea, vomiting, headache, diarrhea, constipation, dizziness, or drowsiness. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. It's important to note that many people using this medication do not experience serious side effects. However, this medication may raise your blood pressure, so it's recommended to monitor your blood pressure regularly and inform your doctor if it's high. Serious side effects may include easy bruising/bleeding, hearing changes, mental/mood changes, signs of kidney problems, vision changes, symptoms of heart failure, and symptoms of liver damage. If you experience any of these serious side effects, it's crucial to seek medical attention promptly. While rare, a serious allergic reaction to this drug may occur. If you notice symptoms such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. It's important to remember that this is not a complete list of possible side effects, so if you notice any other effects, it's best to contact your doctor or pharmacist for guidance. If you are in the US, you can also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Advil Migraine, which contains ibuprofen, is a nonsteroidal anti-inflammatory drug that may rarely increase the risk of a heart attack or stroke, especially if used for a long time. This risk may be higher for older adults or those with heart disease, high blood pressure, diabetes, or a family history of heart disease. It's important not to take this medication right before or after heart bypass surgery. There is also a rare risk of serious bleeding from the stomach or intestines, especially for older adults. If you experience severe stomach pain, black/tarry stools, or vomit that looks like coffee grounds, seek medical help immediately. Other serious side effects include chest/jaw/left arm pain, shortness of breath, weakness on one side of the body, and sudden vision changes. It's important to talk to your doctor or pharmacist about the benefits and risks of taking Advil Migraine, and to follow the recommended dosage and timing for best results. Before taking Advil Migraine, it's important to talk to your doctor or pharmacist if you have any allergies to ibuprofen, aspirin, or other NSAIDs. It's also important to discuss your medical history with your healthcare provider, especially if you have asthma, blood disorders, heart disease, high blood pressure, kidney problems, or are pregnant or breastfeeding. It's important to stay hydrated while taking Advil Migraine to prevent kidney problems, especially if you are an older adult or taking certain medications. This medication can also cause dizziness or drowsiness, so it's important to avoid alcohol and marijuana while taking Advil Migraine. Additionally, Advil Migraine may increase your risk of stomach bleeding, so it's important to limit alcohol and stop smoking while using this medication. It can also make you more sensitive to the sun, so it's important to use sunscreen and wear protective clothing when outdoors. Finally, if you are planning to have surgery or are an older adult, it's important to discuss the risks and benefits of using Advil Migraine with your doctor. Women who are pregnant or breastfeeding should also consult with their healthcare provider before using this medication. It's important to be aware of potential drug interactions when taking Advil Migraine. Some medications, such as ACE inhibitors, corticosteroids, and blood thinners, may have an impact on how Advil Migraine works in your body. It's important to keep a list of all the medications you are taking and share it with your doctor and pharmacist to avoid any potential issues. Additionally, be cautious when taking other pain relievers or fever reducers, as they may have similar effects to ibuprofen and could increase the risk of side effects. If you are taking low-dose aspirin for heart attack or stroke prevention, it's important to discuss this with your doctor to ensure that it's safe to take with Advil Migraine. When taking Advil Migraine, it's best to follow the recommended dosage and timing. If you have any concerns or need to take other medications, be sure to consult with your doctor for guidance. If you suspect an overdose and notice severe symptoms such as passing out or difficulty breathing, it's important to seek immediate medical help. In the United States, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include severe stomach pain, trouble breathing, and extreme drowsiness. If your doctor has prescribed Advil Migraine, it is important not to share it with others. It is important to have regular medical and lab tests, such as blood pressure and kidney function, while taking this medication. Make sure to keep all medical and lab appointments and consult your doctor for more details about these tests. Remember to follow your doctor's instructions for the best results. If you're using Advil Migraine regularly and you happen to miss a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Do not take a double dose to make up for the missed one. It's important to store Advil Migraine at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and out of reach of children and pets. When you no longer need it or it's expired, be sure to properly dispose of it by consulting your pharmacist or local waste disposal company. Do not flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.